Hello everyone. Did you know that heart disease is the #1 killer for Malaysians? Every year, many Malaysians die from heart disease, and it is often a silent killer. Therefore, it is crucial and important to have regular health checkups, especially for your heart. Today, we shall delve into some of the myths and misconceptions surrounding heart checkups. In reality, heart disease affects people of all ages. Of course, the most common age group that is affected by heart disease are those in the 50s to 60s. The average age of a person getting a heart attack in Malaysia is 56. However, the youngest patients that I've treated for heart disease range in their late 20s to early 30s, and it's increasingly getting more in number. Therefore, there is no such thing as you should only have your heart checked when you are older. I think checkup should begin as young as 30. Well, even if you feel fine, it is quite possible that you still have some narrowing or stenosis, we call it, in your heart. As many of us know, heart disease is a silent killer, and in some unfortunate patients, the first symptom of heart disease is sudden death. And that is why it's important to perform your heart checkup early on before you have any symptoms. Yes, indeed. While exercise is indeed beneficial for the heart, it does not guarantee immunity against heart disease. In fact, I'm sure we have heard about many pro athletes, footballers who have collapsed during their sporting activities due to heart problems. And that is why it is important, despite being a very avid or strong athlete, that you have your heart checked up by a physician at least once a year. Yes, while home devices can provide some form of monitoring, it does not replace the accuracy and the sensitivities of doing a proper heart checkup. Home devices generally measure your blood pressure, your oxygen saturation, maybe your pulse rate, and some advanced ones can even do a simple ECG. However, these are not enough to confidently rule out any form of heart disease. And as such, it's important to bring this data and information, discuss it with your doctor, and see if any further tests or investigations are necessary.